Welcome to the Charis Pharmacology. In this video, we are going to be looking at pharmacokinetics, absorption. Now, we know that absorption is the administration of a drug. The drug can be administered by various routes. We have oral, parenteral, we have sublingual, we have rectal, and so on and so forth. And for parenteral route, we have the intravenous into the vein, intramuscular into the muscle, subcutaneous into the subcutaneous tissue, interarterial into the artery. What other one again? Epidural into the dural matter of the spinal cord, and so on and so forth. When a drug is taken or given orally, the drug will of course have to go through the esophagus into the GIT, the gastrointestinal tract. And when a drug is given intravenously, it goes directly into the bloodstream and so on and so forth. So, talking about absorption of the drug, we are looking at the process by which the drug moves from its site of administration, into the systemic circulation, and into the bloodstream. And when we talk about site of administration, we are looking at the route or routes of absorption, be it orally, sublingually, rectally, or any of the parenteral routes of administration. Now, let's look at what happens in the lumen of the small intestine. This is, remember that the small intestine is a hollow tube, right? So this is the lumen of the small intestine. If I have a drug, I took a drug and I took this drug orally. This drug that I've taken orally will have to cross the cells, cross the cell membrane, then cross the cells and into the blood vessels of the small intestine. This is absorption of this drug from its site of administration into the bloodstream. So there are actually four processes by which a drug can be transported from its site of administration into the bloodstream. Of course, it has to pass through the cells, pass through their cell membrane, their lipid layer, and those cell structures. We have four transport mechanism or mechanism by which a drug is being transported from its site of administration into the bloodstream. The first one we commonly know is passive diffusion. So for this first cell here, we have passive diffusion, whereby a drug diffuses into the lipid bilayer passively from a region of higher concentration to a region of lower concentration, you know, across its diffusion or concentration gradients. And of course, this is the cell membrane. This is the nucleus, and it just passes through. Drugs that does this or that undergo this kind of transport mechanism are basically hydrophobic small drugs. They are very hydrophobic. That means they are water hating. Another name for hydrophobic drug, you can call it the lipophilic fat loving, lipophilic small drugs. Remember from our cell physiology that the cell membrane is made up of phospholipid bilayer. So we have our phosphate head and our fatty acid tail, phospholipid bilayer, phosphate head, fatty acid tail, and anything that can easily diffuse through the cell membrane ought to be lipophilic and small. So drugs that undergo um, passive diffusion transport mechanism are small hydrophobic or lipophilic drug that can diffuse from region of higher concentration to region of lower concentration. So let me just write that down for small and hydrophobic rather hydrophobic or lipophilic drugs. We now have another transport mechanism in which the drug might be hydrophilic. hydrophilic. That means the drug might be water loving, and also the drug is small. So if I have a hydrophilic, from the word feel, pedophile, hydrophilic, love, hydro, water loving, hydrophilic small drug. This drug entering into the lipid bilayer would require certain carrier proteins to facilitate its movement from a region of higher concentration to a region of lower concentration. And these carrier proteins are actually the transmembrane proteins or integral proteins. If you remember from your cell physiology, this is the cell membrane. So this particular drug will be facilitated to be transported from, you know, region of higher concentration to region of lower concentration. This particular transport mechanism is referred to as facilitated facilitated diffusion. It commonly transports small hydrophilic drugs. We have the third transport mechanism in absorption of the drug, whereby the transportation of this drug into the cell membrane would require carrier proteins again, but it is against its concentration or diffusion gradients. And those drugs are actually still hydrophilic, but they may be small or even large, depending. This particular transport, requires transport proteins that uses energy in form of ATP. So let me just write it here. ATP is being used to transport drugs against its concentration gradients. This type of transport mechanism is called active transport. So they may be small or big, and they are, of course, hydrophilic, water loving. So the transport, we know that ATP here is used in form of energy to transport, these are the carrier proteins to transport drug against its concentration gradient. That means from lower concentration to higher concentration. This particular transport again is called active diffusion. Now, there are sometimes we have a very large drug that cannot pass through any of these transport mechanism: passive diffusion, facilitated diffusion, active diffusion. So these drugs are basically very large, and um, they are of course hydrophilic, water loving. That means they can dissolve in water. So the particular kind of transport that this drug will undergo is what we call endocytosis. If you remember from your cell physiology, endocytosis, otherwise known as bulk transport. So it is transportation of large drugs. Now, when this drug comes close to the cell membrane, very large, the cell membrane will then invaginate. Is the drug The cell membrane will invaginate to swallow up the drug into the cell. This is called bulk transports. An example of drug that undergo this type of transport are the vitamin B12, the B12 drugs. For example, if I have B12 drug in the small intestine, the intestinal floor would actually endocytose the drug and then exocytose this drug into the bloodstream. So these are the transport mechanism of absorption of drugs when they are at their site of administration before they are absorbed into the systemic circulation. Let's talk about the factors that can affect drug absorption in any of those transport mechanisms and even within the bloodstream. So let me just clean this. I hope you get that. I will leave this diagrams on the board. So let's talk about absorption of the drug. We have several factors affecting the absorption of the drug. One of them is pH. The pH of the environment in which the drug is being absorbed is, determines the rate of absorption of the drug, or whether the drug will be absorbed or not into the bloodstream. Now, most drugs are actually, let's say this is drug A, this is drug A or pill A, and drug B. Drug A is an acidic drug. Most drugs are actually weak acid and weak base. So this is a weak acid and this is a weak base. An example of drug that is a weak acid is aspirin, i.e. aspirin. An example of drug that is a weak base, there are lots of them: imipramine, lidocaine. Let me just go with amphetamine, a CNS stimulant, amphetamine. So most drugs are weak acid and weak basic. Yes, so the pH in which this drug is being absorbed, the pH environment can actually influence the absorption of the drug. So let's take for example acidic drug. They say acid most drugs are weak acid and weak bases, right? For acidic drug, of course, this is a weak acid drug, Ha, from our basic knowledge of chemistry. They will ionize to form H plus and A minus. So this is the unionized or non-polar form. This is now the ionized form, ionized proton, and of course this is the conjugate base, ionized form and ionized or ionic conjugate base. If you look closely to at this particular ionic equation, you can see that if I want this particular weak acid, this particular drug, to be readily absorbed into the bloodstream, I can't use the ionic conjugate base of this drug because it's A minus, A negative. This is because if I have A minus, I have a negative ion, which is polar, it will not pass through the lipid, the phospholipid bilayer of the cell membrane. Remember, phospholipid. The cell membrane is made up of PO4 minus of a phosphate head. Now, this phosphate head is negative, the conjugate base is negative. Hence, it will repel. So it won't pass through the cell membrane because of this phosphate group. So this particular form of this acidic drug is not readily absorbed. The H plus, the ionic form, cannot also be readily absorbed because it is polar. It is only the unionized form or the non-polar form of this drug that can be absorbed. Now, according to Lacatellia's principle, if we increase if we increase the proton, the equilibrium position will shift to the right. That means more of Ha, more of the unionized form, or more of the non-polar form will be produced. So a way to increase this proton is if this particular drug, which is a weak acid, is now found inside an acidic environment. Of course, an acid is a substance that gives hydrogen proton, that gives off hydrogen ion. So if there's an increased proton, an acidic environment like the stomach, more of Ha will be formed. But the stomach is made up of a thick mucous lining, so drug does not really get absorbed via the stomach walls. It actually, the closest place or the most acidic place in the stomach of which drug is being absorbed is the proximal duodenum. The proximal duodenum. That is the closest place of which drug is being absorbed. Let's talk about so you have understood that for weak acid like aspirin, which are acidic drug, they can only be absorbed in an acidic environment like the proximal duodenum. in an acidic environment because of more of this is formed, and of course the non-polar form is readily and easily absorbed. Let's talk about weak base. An example is amphetamine. Let's talk about weak base. Let me just clean this, and I hope you get that right. Weak base. So this is a weak base. I have BH plus, I have B, and I have H plus, right? Ionization. So this is the ionized form, which is polar form. This is the non-ionic form, or non-ionized form, which is of course non-polar. And this is the ionic conjugate uh, base. I don't think this is the ionic conjugate base. This should be the acid or so. But anyhow, ionic form also. Now, of course, the same thing for our weak acid. It is only drug that is non-polar and non-ionic or unionized that will be readily absorbed. So we need more of this because this is readily absorbed. And according to the Cartelia's principle again, decreasing H plus will cause the equilibrium position to shift to the right to produce more of the unionized or polar form of this weak basic drug, decreasing the proton, which is of course an acid or an acid particle, would occur in an alkaline environment. And the most alkaline environment in our GIT is the distal ileum, which is alkaline. So this brings us to a conclusion that weak acid or weak drugs that are acidic, weak acidic drugs are better absorbed in acidic environments like the proximal duodenum, and weak bases are better absorbed in an alkaline environment like the distal ileum, because we need more of the ionized form, more of the non-polar form, which can be easily absorbed. So that is how pH, in summary, affect the absorption of a drug. Another factor that affects the absorption of the drug is blood flow. Some organs are well perfused, that means they receive more blood flow than some organs. So blood flow will affect the this absorption of the drug. Remember, when a drug enters the systemic circulation, some drugs are they are readily available to the brain, the kidney, the heart, the liver. But drugs like but organs like the skin and the adipose tissue are they are less perfused. So drugs are not easily absorbed to those organ or tissue sites. Another factor affecting the absorption of a drug, of course, is the drug solubility, and I've explained through this mechanism, this transport mechanism, that the solubility and the size. So let's put just solubility and size. The size and solubility of the drug affect the absorption of the drug, and there are different transport mechanisms that can influence them. The one I just explained. Another factor that can affect the absorption of the drug is is the P glycoprotein. I think this is still on transport mechanism. There are some proteins on the cell membrane that act like a spitter. So they spit out drugs. So let's say I have a cell here. This is the nucleus. I have a P glycoprotein. I have a P glycoprotein. When a drug enters into the cell, this P glycoprotein will spit out the drug. This can affect the absorption of the drug, and it is seen in multi-drug resistance theory. So that is all. We also have other factors like the contact time, total contact time, and the surface area, and cut contact time of the drug in the GIT. Of course, we know from our GIT physiology that the small intestine is lined by microvilli or villi that increase the surface area for absorption. If there's a disease condition like IBS, inflammatory bowel disease, an inflammation of or a disease condition that affects the small intestine or any part of the GIT that is necessary for absorption, it can actually decrease the absorption of drug. It can decrease the absorption of drug. So that these are just some of the important factors that affect the absorption of drug. We have pH, blood flow, solubility, and size, the P glycoprotein, the surface area, and contact time. That is all, and I hope you learned something. Thank you.